I was diagnosed this summer with non-Hodgkin's lymphoma, which is an aggressive form of cancer. By some counts, as many as 40% of new cancers are lymphomas. It's a cancer of the lymphic system, so that means it's body-wide and can't really be treated with radiation or surgery usually, which leaves chemotherapy. Chemotherapy is an attempt to try to kill off the cancer without killing off the patient. Chemotherapy is indiscriminate. It's a shotgun blast that kills hostages and terrorists both. But right now it's the best approach we have to systemic cancers like lymphoma. So after my diagnosis, I was put on a regime of 6 rounds of R-CHOP chemotherapy, and I was given that on an outpatient basis, which means I came into the clinic here on Tuesday morning, usually by 8 o'clock, because my particular chemo lasted between 6 and 8 hours. The chemicals are given one at a time, starting with R, which is rituximab, a ridiculously expensive medicine that has been added to chemo in the last few years and has resulted in significantly better survival rates. They give you the chemo in slower dosages at first to see how your body tolerates it, and then as you respond or don't respond negatively, they increase the dosage. One of the chemicals that I remember getting, the C, which I can't pronounce, is a derivative of mustard gas. So another one is called Red Devil. Because of the color, it turns your urine. And one of the things you can't see, but behind me is the bathroom, because as fast as they put these chemicals in you, they want to get them out of you so that they do the least amount of damage to your organs as possible. So I would be here for that long. I would get the injections, and then I would go home to recuperate. It takes your body about 3 weeks on cycle to go down to the nadir and then to recover sufficiently to where you can get another dose of chemotherapy. One of the best things about the clinic, if you have to come to a clinic at all, is the caliber and the compassion of the staff. And you also get to meet some wonderful people who you find sitting in the 10 or 12 chairs that are part of the outpatient clinic. People dealing with every stage of cancer, and it's a heroic group, both of staff and of what I call clients, that you find in an environment like this. The word cancer usually makes people think about terminal, and 1 out of 4 people in the West will die from cancer. It's a disease that has become much more prevalent since the end of World War II. It's been encouraged by the change in diet, by the amount of pollutants that are now in our food, and by several other environmental concerns. So while it's unusual for somebody at my age, 56, to get a cancer, it used to be considered an old person's disease. It's becoming a lot more prominent. One of the main approaches, as I mentioned, to lymphoma is chemotherapy. The range of chemicals that are available and the dosages are set by the kind of cancer and whether you have any mitigating circumstances or not. Putting the chemicals in is a relatively easy process, although it's very carefully monitored. In my case, it was put directly into a port, which was surgically put into my chest with a line that goes down into close to the heart. And the reason for that is the chemicals are so toxic that they've got to be infused in an area where they'll be dispersed as quickly as possible through the body. And then the goal is to get those chemicals out of your body as quickly as possible. They then go to work on your fast multiplying cells, of which cancer is one type. Unfortunately, it also affects your hair growth cells, the cells on the inside of your mouth, the lining of your esophagus, intestines. Those cells are also killed off most quickly by chemotherapy. It takes you about 7 to 10 days to reach what's called your nadir. That's your low point, when your white cells, your red cells, your platelets are at their lowest due to the chemotherapy. And then you take another couple of weeks to build back up, and as soon as your blood counts get somewhere near normal, you go in for your next round of chemo. So I had 6 rounds here on an outpatient basis. They also give you a wide range of drugs to deal with the side effects, and the side effects can be anywhere from mild to severe. Hair loss is one of them that usually takes place with most chemos. Nausea, some vomiting. My worst side effect through the R-CHOP was the sleeplessness. I finally had to get on sleeping pills to get some rest, and that seemed to make the biggest difference for me as far as coping with the other side effects.